Hi, everyone. This is Lucas Voss with Becker's Healthcare. Thanks so much for joining us for today's webinar, Prevention in Practice, Rethinking Health Cost Control. A very important and exciting topic. Before we begin, just a few quick housekeeping instructions for our audience here. If you have any questions for our speakers throughout the webinar, please feel free to type them into the Q&A box you see on your screen. We can follow up to get you an answer there. Today's session is being recorded and will be available after the event as well. You can use the same link you used to log into today's webinar to access that recording. If at any time you have any issues with audio or visuals, try to refresh your browser first. That generally works. You can also submit any technical question into that Q&A box. We're certainly here to help. And with that, I'm so excited to have such an amazing panel for this discussion today. I'm so excited for the questions we're going to go through together. I do want to kick us off with introductions for those that might not know you yet, at least. If you could just give us a brief introduction of yourself and just talk a little bit about your role and your work in healthcare. Shelley, why don't we kick off with you?
Hi, good. Glad to be here. My name is Shelley Shore. I'm the Chief Financial Officer for CommonSpirit Health's California region. We are pretty extensive with 29 hospitals and multiple ambulatory care sites. CommonSpirit Health is the third largest health system in the nation, I believe, after the VA and Kaiser. I have been with CommonSpirit for almost 9 years. And before that, I came from the Midwest. So have a nice varied background between the Midwest and California, and really appreciate being here. Thank you for having me.
I'm sure the temperatures are a little bit nicer than
They
they are.
are, especially this week.
Very true. Michael, over to you.
Hi, good morning, everyone. Glad to be here. My name is Michael Sloan. I'm the Market Vice President of Human Resources for our Central Coast, North State, and Sacramento markets in the California region. I worked with Shelley quite extensively. I won't go into the background. She did a great enough job giving the overview of where we operate, but I've been with the organization close to about 12 to 13 years. I'm not entirely HR oriented in my career. I'm an attorney by trade. I was in private practice and was a prosecutor in the Midwest before coming over to the healthcare side of things. So glad to be here and looking forward to the discussion.
Well, last but certainly not least, Scott, over to you.
All right. Thanks, Lucas. It's great to be here. Great to see everyone today. I'm the CFO here at Personify Health. I've been here about 2 years. I've been both a private equity backed and public company CFO. Been in and around healthcare my entire career, from pharmaceuticals to clinical research organizations, clinical trials, and then all the way into this healthcare space with Personify Health. Our mission is to make health easier and lower costs for employers and members. And we've brought together a modern TPA with compassionate navigation, holistic coaching to create an experience in serving our employers and our members across various spaces, health systems as well. Thanks, Lucas.
Yeah, it's great to have you. And we do have two CFOs on the call, so this statement might seem a little obvious. We know that costs continue to rise. Everybody is aware of that, not just CFOs. But recent reporting also shows that preventative care utilization is declining across employer populations, again, according to multiple reports there. What specific actions is your organization taking to address this trend, and what are some of the outcomes that you expect to achieve and see, both when we're talking about financially, of course, but also operationally? Shelley, we'll start with you on this one.
Yeah, what we found, and obviously my vice president of HR can jump in, but what we have found is making sure that we have adequate care for our workforce, whether that means we have free mental health care that they can access at any time. We have a robust PTO, paid time off schedule. We have a leave of absence program for illnesses. We are very careful about making sure that we are mindful of the workload that each of our coworkers have, and that we pay attention to what the needs are in the workplace, whether it's emotional support or physical support. And we do know that not only does that decrease turnover by keeping your workforce healthy and happy, but it also decreases the cost in the organization by not having to backfill with more expensive type of labor, whether it's a contract labor or missing, someone's just out and things get stalled. So that's also expensive. And then anytime your workforce is sick, you're going to end up also paying the healthcare benefits for that. So definitely, not only do you want a happy and healthy workforce, and it's better for your culture and better for your team, but it's also better financially. I don't know, Michael, would you like to jump in on that? Because I feel like we've got a pretty good program for our teams.
Yeah, and to sort of segue off of that, of what Shelley said, looking from a standpoint of what our workforce needs, not only giving them the resources and the avenues to sort of address some of what they're dealing with, from whether it be workload or burnout, we have a robust EAP program that may help them with any resources that they may deem necessary for them to do their jobs, as well as to address maybe any external pressures. But looking internally, in terms of from a compliance standpoint, in terms of what state and federal guidelines implement on us to sort of coincide that with leave, PTO, sick time, looking at our collective bargaining agreements, seeing what not only what we're obligated to do, but what we can optimize and scale to maybe better suit them and their needs. I'd also like to even go a little bit further in currently in what we're doing and looking at the functional job. Is our scheduling the right structure? Do we have the right amount of FTEs to help with workflow? For our patient-facing positions, we're mandated in the state of California with mandated staffing ratios. What are we doing to address that so we're not only trying to decline the impact of being overworked, but making sure we have the right staffing at the right time and in the right place?
When we're looking at preventative care specifically, just from your perspective too, when we're looking at the people itself, right? Are people taking more advantage of it, or are you seeing some similar that we were seeing in the reports in terms of people not taking advantage of preventative care across a whole employer population?
Well, I would like to say yes, we are. We have not only our internal resources, as I said, mentioned before, or as I said before, the EAP aspect of things, but partnering with outside vendors to provide said resources, whether it be mental health, whether it be substance abuse, whether it be in our engagement surveys and having them tell us what they're experiencing day to day, so our managers can be organic and holistic in terms of, okay, maybe I do need to take a deeper look into this. And if that doesn't work, we also have those other opportunities and avenues to help address those concerns from employees with our outside vendors, as well as our internal policies and resources that we've given in not only in the state of California, but throughout our system. And we feel that they've been capitalized on enough that we're really seeing the return on investment where people feel supported in their roles, feel supported in what they're going through, and that their employer, Dignity Health, CommonSpirit Health, are really addressing that in real time.
Yeah, more holistic approach really to achieve that for the employee, which is so key. Scott, I wanted to come to you here. We had a brief conversation about this too. You're actually seeing the opposite of some of the data that we were seeing on our end when I was preparing for this conversation when it comes to preventative care. Again, I'd love to get your perspective as well on this. What are you seeing when it comes to preventative care, and what are organizations doing to really address this trend, and what are some of the outcomes that you're seeing?
Yeah, great, Lucas. So we're actually seeing, to your point, an improvement in preventive care, and that's in our own population here at Personify Health. And just to highlight a couple of data points, one, our preventive care gap compliance increased 9%, 25 versus 24, and we've seen an increase in preventive medicine office visits by about 9% from 25 versus 24 as well. And the way we're doing that is we're taking a similar approach as Michael and Shelley have described. It's a holistic approach and an integrated approach to serve our members. And what we do is we encourage healthcare screenings and health checks, and we leverage that health screening data for our own organization and our clients, right, to segment the population, identify those risk factors, and then tailor a recommended plan for those members. That's our focus. That's what we do. And what we're seeing is through the Meredith study, we're seeing 23% more preventive visits as a result of this. And one of the other things that we do is we provide incentives, right, for employees to drive engagement. And that could be accruing points and earning rewards that get gift cards. And it also could be discounts on your benefit programs. But those incentives help drive the behavior and drive people's engagement in the platform. And I think just like Shelley and Michael described, ultimately, prevention, the reason we do prevention is to drive and improve ultimately health outcomes in the long term. And that ultimately we believe will reduce cost in the long term as well.
And I think the engagement piece is often overlooked. That's such an important part of the conversation is having the employee engaged. And actually, as an employee myself, knowing about preventative programs, what are the programs that I can take advantage of as an employee, is so crucial within an organization. I do want to talk a little bit more about some of the specifics that we're seeing here, right? We talked about the pressures from a financial perspectives. There's a lot of attention on high cost claims right now. Again, we're talking a lot about GLP-1s, et cetera, and CFOs are having to make trade-offs. It's a natural part of the conversation, a natural part of business. How do you ensure prevention and long-term employee health stay part of that conversation when you're managing those cost pressures, right? And what are some of those steps that you're taking to make sure that that's actually happening in a timely manner, even when we have those cost pressures that we've touched on? Shelley, would love to get your thoughts on this.
I think some of this goes through the way that we manage our health plans provided to our employees. We make sure that they have annual wellness checks and that they are seen by a physician. I think there's benefits in most of the plans to keeping that up. I know that the GLP-1s, and I don't know specifics on any of the contracts that we've negotiated on because we have different health plans throughout the country, but I do know that as a rule, the GLP-1s are helping to use those to not have stronger comorbid conditions, and it is keeping them healthier. So the drug is a little bit more expensive, but we're not seeing the health implications from the other things that GLP-1 is helping prevent, such as obesity and diabetes control. And I believe that we continue to work with our workforce, not only to make sure that we have appropriate benefit packages for them. That's something that we're constantly focusing on and making sure that they're adequate for our workforce, but they provide the things to keep them healthy. And then we also have wellness programs and wellness apps that I think encourage good behavior. And again, I'll punt to Michael and see if you want to add. This is a lot in your space too, but having a healthy workforce is, like I said earlier, is just better. It's just better to manage in healthcare. It's the most expensive resource we have is our human capital. And it's a very talented, experienced, educated workforce. And we don't want turnover and we don't want illness. And that's always expensive. Michael, what would you add?
Yeah, I mean, again, you've hit the nail on the head, Shelley. I would also even mention that it's not, we've realized that it's not enough to have these resources and to have the ability to address certain, whether it be comorbidities, mental health, or just in terms of employee health prevention, but incentivizing them with our wellness plans, having maybe in some sense having it gamified, but as well as communicating and being transparent that this is here for you. And I would say not offering them a wide array of resources, but really looking down towards the root causes in terms of what are the triggers or the levers that really people want or need versus, well, here's 20 things to choose from, go to this platform and choose from it. It's not enough anymore that employees want to take that time and have to scour or navigate on their own. But for us as the employer to go down to them and to incentivize them to say, this is what we're hearing, this is what we have, and this is what we're doing. Please take advantage of that because it is important not only to make sure people are taken care of, to prevent certain burnout or health issues from arising to a level where we're seeing a migration outwards from our organization, but to retain them, to keep them at work, to say that they are really utilizing what we put together and that we've been transparent and is communicating that on a regular basis.
Shelley, just as a quick follow-up to this, because you mentioned it, I think it's very crucial. How important is it from a CFO's perspective to have that constant evaluation piece of looking at, okay, what's actually happening? How are they interacting? Why is that so important for you?
Well, I think it's really important because anytime anything that I look at must have data and support. Number one, that's where the facts are, right? So we want to look at the trends and we want to make sure that what we assume is happening is actually happening. Um, just because something's put in place, it doesn't mean that it's actually the execution of it works really well. So let's say that we had a great health plan, but in a certain geography, it didn't work for them because of the access to care, or I'm just making that up, but something like that.
Mhm.
We do want to follow up with the data and the utilization and to make sure that what we're providing and what we assumed was working is actually working and that we're seeing the benefits from our workforce. And we do follow up on all the data, not only on our health plans and our patients, but also our coworkers, and just to make sure that we've got adequate things in place to keep everyone healthy.
Yeah, absolutely. Scott, I'd love to get your perspective on this as well, specifically on the conversations that you're having too with other CFOs on this. And again, what are you seeing? What are organizations doing? What are you doing to make sure that this actually happens, that we have that balance between cost, but then also making sure that employees receive timely interventions that are needed to keep everyone healthy?
Yeah, well said. I think that you just hit it. The key is like, how do you balance the short term with the long term needs of your employees and their health, right? And it's always a challenging and delicate balance in partnership with HR to do that in the best way for your employees. And what I would say is, when if you think about GLP-1s as an example, right? It's important and critical to give your employees access to drugs like GLP-1s for diabetes and weight management. At the same time, you want to make sure you provide the wraparound support to drive the behavior change so that people alongside the use of the medication, right? It's really important that you do that and you support things like nutrition, you support physical activity and strength so that you balance the drug alongside that. And we very much have programs to support and drive all that. So for us, that's really important. It's also from a cost perspective. You want to provide people access to this, but at the same time, you want to look at alternative ways and cost effective ways to be able to provide people access to these drugs like HRAs, direct drug purchasing, things like that, where people can access these drugs perhaps for lower costs. So these are things that we look at to make sure that our employees get, important medicine that are going to drive health outcomes, but at the same time, you got to balance the cost aspect of it. And then we also do, with our TPA, we do a lot of payment integrity and need to drive itemized bill reviews and look at things to lower cost alongside that too. So we try to look at all these things, but it's so important that you're balancing, the short term with the long term and cost versus the benefit to those employees.
Yeah, which brings me to my next point here, which again, some of it we've touched on, right? But it's really it gets complicated because there are so many factors that are touching this piece of the business itself, right? And it is a holistic approach, like Michael said. It needs to be a holistic approach where everything is looked at once. And we talk a lot about holistic health and condition management, and certainly longevity, sort of as cost levers, specifically from a CFO's perspective. We've talked a little bit about some of the steps that you're taking to make an impact for your workforce and why you're taking those. And Michael, I'd love to come back to you here. What are some of those steps that you're taking right now that you're looking at maybe for 2026 to make a tangible impact for your workforce? And why are these specific steps?
Well, I mean, again, we're not throwing anything different at it that we haven't in the past, but we're always looking to revise or maybe pivot or adapt, whether that be in the employee health wellness arena, as well as I mentioned earlier, do we have the right structure in place from a scheduling standpoint? Are we really looking at uh, balancing the needs of the employee in terms of what they need versus what we need as an organization, which is primarily taking care of our patients? And we're looking at, as I said, the core function of a job. Is the core function of the job really what it means today versus what it meant yesterday? Is the workflow the same? Is the scheduling the same? Can anything be changed to help better sort of balance that? So in addition to the resources we have available, we're looking at some of our costs associated with, is our scheduling, is the core functions of our job Are the jobs that we're hiring for really what we need right now to help address both, to help address and balance costs associated with that? And I think we can get into it a little bit more in terms of what those costs look like from a financial standpoint and the people standpoint, but tying those together, not only from a bottom line standpoint, but to sort of balance those interests of what we're doing currently. And right now, as I said, we're really getting some traction around that workflow aspect of things that really affect and impact the financial, organizational, and clinical aspect of things. Because one, it may be seen primarily as a financial cost driver, but also on the employee health, burnout, and employee health prevention aspect of things.
Yeah, absolutely. Shelly, why is that from a CFO's perspective? And again, just what Michael said, right? From a cost perspective, why is that holistic look so important when we're talking about this? And again, just echoing what Michael said in terms of the steps that the organization is taking, but why are they making an impact for you from a CFO's perspective?
Well, and this probably is a pretty like a elementary answer I'm going to give you, but taking care of the whole person is keeps them well. So you can be physically fit, but still have so much stress and mental health that you make yourself ill, or you can't concentrate and you're not effective at work. And I just think that all of those things are so important, just like Michael said, and like Scott said about the nutrition balance. I mean, we've done studies for years before GLP-1 on diabetic education and the impact of not seeing a diabetic crisis patient in the ER. And so we know that creates better, not only better healthcare, but less expense. These people can get really sick if they don't know how to manage their nutrition. And GLP-1 helps manage the endocrinology, but it doesn't help manage everything. You still have to eat appropriately and be mindful of your exercise and health. All of those things, a holistic approach is what makes somebody completely healthy, and that's what's costly. When the illnesses get too severe or too acute, we see a lot more cost going into the care just because it takes more medication, it takes more support. Sometimes it takes more programs. This can even you could end up in septic situations if it goes too long, different things. So we don't ever want to see that, number one, for a healthy community or a healthy workforce, but it is always quality medicine and quality outcomes always drive good financial performance. And so we not only want to do it for the culture because we care about our people, but also it really does. It's an investment that we're making in our workforce, and it's very important. And the holistic picture is part of that. I don't think you can treat just part of the person and expect the same excellent outcomes.
Yeah. Scott, turning it over to you here too. Again, we talk about those cost levers that we've touched on just now, but what are some of those steps that you're looking at again to make that tangible impact for the workforce and why those specific ones that you're looking at?
Yeah, so I think it all starts with prevention, and prevention, as we mentioned, is to identify, the different types of population segmented, identify the health risk factors, and then drive health outcome improvement tailored based upon the risk factors that each individual has, right? That's really critical, and that will drive long-term cost benefit. In the short term, we do a number of actions, including case management, which includes medical reviews, utilization reviews, as well as managing your large cases, right? And a lot of this is about meeting the member where they're at. And the earlier you intervene, the better. And really understanding and getting early data on as these conditions evolve so that you can intersect them earlier and identify the best treatment path for that patient from a care perspective and also from a cost perspective. So it's super important in those large cases to do that. And then we also do, payment integrity, which is, cost containment, as I mentioned, like itemized bill reviews, repricing of out-of-network claims, really looking at that fraud, waste, and abuse, across the system, which we know is so significant, and helping extract that, for our members and our employers. So like that's really a lot of what we do, to drive that cost management. Engagement, of course, is super important, right? As you think about, all this.
Yeah, and I want to stick with that engagement piece again. Shelly and Michael talked a little bit about the apps, right? You have apps that folks check in on. You have material that folks are again making them aware. Hey, these are options for you as an employee. These are things that you can take advantage of as an employee. And Scott, I asking you this too, right? Engagement is so critical, as you just said. What are some of the approaches that you've seen work to encourage employees really to participate in screenings, take care in preventative screenings, right? Primary care, et cetera. What are some of those, what are some of those approaches and how do they work without creating friction, right? I need to have an app that actually works.
Yes, yes. Um, and I would, there's a lot of also great, apps and things that are available, and you see so many of them that are so low utilized, right? And and you want to make sure that all the information that we have, you want to make it available so people are engaged and utilized. That's why all this is so important. There's studies out there with mental health where 85% of these solutions aren't even being utilized and accessed, right? Like what we want to do is drive engagement so that these tools are utilized to create the best health environment for these members. So what we do is we have incentive programs, and we've created a whole host of best practices for member engagement around these incentive programs. And for example, members can earn points; those can turn into gift cards. They also can earn discounts on their health plan. I personally, if I get more points, I get a discount on my health plan. So here at Personify Health, so like it drives my own personal behavior to do this. So it's real, and it definitely drives behavior. And I would say you can also do incentives that we create that are driven actually based upon claims data. So where you can actually reward people through incentives tied to behavioral changes. Like this is also something that we try to do. And it could be just recommendations around screenings or actions that we're recommending people take. And then we see it through the claims data that they did it and they can get the incentive. The other way we do it is through challenges. We create challenges to just make it exciting for employees. To competition brings out a lot of interest in people and can bring out the best and worst in people. But either way, people are excited to join challenges and join them and participate in them. So we do a lot of these, from Planksgiving, where plank competitions to mindfulness sessions and challenges. So we try to do a lot of things to make it fun and exciting for employees to want to be part of and join it and be part of a team.
Yeah, the engagement piece again, really making, and I love the gamification aspect of it, right? It appeals to a wide range of people depending, or the competition piece, right? Michael, is that something that you're seeing as well? When we're looking at the digital experience, it's so important for employees today because everything is digital. You have to have a digital front door almost. Is that something that you're seeing work as well when it comes to engagement, and how are you approaching this?
Yeah, I mean, similar to what Scott said. I mean, I have yet to see the secret sauce of someone that says we have set the standard, right? And I think everyone is moving to that AI app or machine learning aspect of things. But again, as Scott said, or maybe you, Lucas, mentioned it, that it was, is it going to be easy to navigate and access? And what is it? What's in it for me? Why are we doing this? And I think, and I mentioned again earlier that, being transparent that not only are these resources available, but this is why the resource is available. Telling them that, for mental health or stress of workload, that causes certain issues for people to be burnt out quicker or at a more rapid pace, and then utilizing a resource or service to give back to the employee to help address that, because what we're hearing from in terms of what we want to give and what we want to offer is really addressing the core issues of what our staff are telling us. This is what I'm feeling. I don't feel part of the organization because I'm taking on more patients on average than I was in years past, or I feel that I don't have access to a professional to deal with external pressures at home that maybe have not been offered in years past. And so we're utilizing that information from a data aspect, pulling those levers, offering that transparency to say, here's how you access it, here's why we're giving it to you, and here's the benefit if it's being utilized. And then looking at it from a data analytics standpoint to say, is what we built enough? Is what we have built and what we have given to our employees enough for them to be utilizing it? And is the cost worth it? Is the juice worth the squeeze, if you will? And what we're seeing is, yeah, at an extended amount of utilization over certain aspects of employee assistance or employee wellness, we're saying, yeah, it is working. People are going using the app, using our HRS platform, using these certain things that we've given that, yeah, they are really capitalizing on it and they're really seeing through with it because we're looking at turnover metrics. People are staying longer because we're seeing and coordinating that with what we've been able to offer and that they've been able to capitalize on, and that we're saying the cost is worth it.
Yeah. And again, two important, very important pieces, which is evaluation, consistent evaluation, like we touched on. And then the other thing, I think even more important, awareness that you've mentioned, right? Awareness of why am I doing this? How is it going to benefit me? And how is it working? Those things are so incredibly crucial. And I love that you've mentioned that. It's so important for the employee or from the employee perspective, especially. Since we have you both, I do want to pull the curtain back a little bit on how Shelley and Michael actually work, right? This and a lot of this depends on alignment between HR and finance. We often talk about alignment and how important it is, but especially in this specific conversation, it is crucial. And Shelley, I'd love to start with you on this. How do HR and finance collaborate to really make that balance happening of managing costs, supporting employee needs, and again, fostering that positive culture, positive workplace that most employers look for?
We're very much in lockstep. We don't operate in silos. We do our specialties, but we do make sure that we're aware of each other's activities. And I talk to my HR partners, Michael and others, often. We do workforce culture surveys, and I'm always in tune on what those say within my region, within my own direct reports, within the how we compare to the rest of the nation. I think those are important. I listen to their data and I provide them data that I see, and we make sure that we're supportive of one another. You know, HR is so good and so talented at managing these health concerns and the culture and the learning and all the things that are important. But we do have to make sure that we're doing it affordably and that we're getting a benefit from it. So I believe that it's really imperative that we stay in lockstep and in communication. And I think we do a really good job with making sure that we're all kind of in the know, if you will, on what needs to cross over.
Yeah, Michael doesn't seem like the guy who wants to operate in a silo, I feel like.
Oh,
Michael, same question for you again. What does this relationship look like for you? I think again, it's really key to look at data is a great example. Some organizations have data in one place and nobody ever looks at it apart from the department that actually has the data, which is not great. But Michael, would love to get your perspective on this too.
Well, let me just first start, and Shelley and her team have been excellent partners, not only to sort of be in lockstep, as she said, to say, what's the affordability? Is it viable from a financial aspect? But to help educate our HR team, HR has moved from reactive service line to a proactive service line. And I tell my team, and I know the rest of the my HR team counterparts have said we need to be more reliant and more able-bodied in the realm of business acumen. Business acumen mean how does the healthcare industry run? The majority of our revenue goes to our people aspect of things. So people is a huge component of financial, operational, and clinical. And when we are in lockstep with finance, saying what are really the key areas that we need from a people standpoint, need to be keyed in on, how does that impact the financial aspect of things? And I think partnering with that, looking at the employee health cost, more specifically, turnover cost. Turnover costs are a big thing. Once we have a vacancy and we have to replace it, how are we doing that? How are we being mindful? Those costs can be astronomical, not only in terms of a vacancy cost, but looking at backfilling it maybe on a temporary standpoint with contract labor. Contract labor is double the amount, maybe in some cases, than what we would do on a definitive replacement with an average person coming out of school or someone coming from an external competitor wanting to be with us. How does that impact everything in terms of what we're doing from that human capital standpoint and being mindful from that financial and business acumen standpoint to say, this makes sense. Maybe we don't need contract labor. Maybe we don't need to offer premium pay. Maybe the employee health and wellness aspect of things, if we do it right, less people would be leaving on a leave of absence or leaving our organization. So we don't have to consider what those vacancy costs mean for us. And I think that is sort of the interconnectedness of it all from an HR and financial standpoint, that we are blessed to have Shelley and her team partner with us to walk through and navigate the pitfalls and landmines before, as they say, before the horse is out of the barn, to say, hey, have you looked at this financial aspect of things? It may be well intentioned, but are we really looking at the other things that may be impacting it and driving that? So again, I think those are some of the primary cost concerns that we as HR have taken into consideration and have worked with our financial counterparts in making sure that we're containing it and or at least, at the very least, addressing it.
An often used cliche, but in this case, it truly takes two to tango to be able to work and dance in conjunction, which is really, really key. Scott, I wanted to get your perspective on this as well, right? What does this relationship look like for you, personally, of course, but also what you're hearing in conversations with others, right? And what helps create shared accountability or those common metrics, right, across functions that are important to be able to achieve some of these outcomes we're looking for?
Yeah, great. And I'm fortunate to have a great tango partner in Brooke that she's a terrific partner to work with. And the good news is, like, we stayed lockstep. In fact, this morning or yesterday morning she called me about GLP-1 program that we could potentially look to do. And like we're constantly talking about how do we best manage, right, employee health and cost. So the good news is we partner together, and truly it's all about a partnership and staying lockstep, having aligned objectives and goals. And we also are fortunate to have Gallagher, our broker, to work with us. And what we do is we have employee survey data. So it all starts with data, right? Employee survey data. We also, with Gallagher, get industry benchmark data to look at, okay, from our industry perspective, and we have little services and we have software. So it's a little bit of a tricky balance, but we try to look at what is the industry benchmark data for a family, what cost of a family, cost of an individual, and how do we line up with that? And how off are we, and where do we want to be, and how do we get there? Maybe not this year, but in time, and how do we balance that? So we do a lot around that, and then we also meet regularly. We meet at least quarterly with our broker, and we go through all the data. We go through and look at how are we performing. We look at how we managing our large cases, so like cancer and all the different difficult cases. How are we managing those? Are we intersecting them at the right time? Are we helping those patients navigate the pathway from a cost and health perspective? Well, what are we doing on payment integrity, right? Like itemized bill reviews and repricing that network claims, and we're looking at a whole host of initiatives on a quarterly basis to say what are we doing to manage our employees and provide the best care for them and cost for them. And in terms of metrics, like we actually have shared joint goals and metrics that we track together around benefit costs and expectations for the year, and then also engagement from an employee perspective. So we really have joint shared metrics that we work together on, and that creates that partnership and shared accountability. This is why we're meeting regularly and why we're constantly having quarterly meetings with our broker to drive these initiatives, to drive the improvements that we're looking for.
Yeah, it comes back to the evaluation piece, of course. And then also in this case, again, we come back to the why. And that's so crucial in a lot of decisions. I love that you all shared that collaborative piece, which is so crucial. As we close out our conversation today, I do want to close this with some learning objectives for folks that might be listening, that might be thinking about their next step here in 2026 and beyond. As you're balancing all of this, as we think about affordability, expectations from employees, from the workforce in general, and certainly the risk that we touched on in the beginning of our conversation, what's one prevention-focused shift leaders should prioritize right now to really support financial sustainability, but then also the employee well-being? Shelley, I'd love to start with you on this one to close this out.
The first thing that comes to my mind is ensuring that people feel that they're allowed to take their paid time off. That we don't have a culture that doesn't prevent that, but there are different organizations that make it feel punitive if you actually use your vacation time. And I think of providing a culture of take your vacation time. That's what it's for, because I think it's good for people to get that mental rest. Making sure that they understand what's available to them, like the app, and we make that fun. We have games, like you said, in the app, the wellness app, and making sure that they understand that there's mental health resources available if they're just having a rough day, and it's confidential. I think those are really, really important because one of the most expensive things in healthcare can be is turnover. To always evaluating the cost of a program or the cost of market raises, even to make sure that we don't have turnover. Turnover is always far more expensive, and so I just feel like we just need to be mindful of the fact that investing in our workforce is extremely important, especially in healthcare. It's our biggest capital.
Yeah, absolutely. Michael, over to you.
Again, I would definitely say, make sure people utilize what they've earned and what we're giving. But for me, we just had a recent pulse survey, our check-in survey for engagement. And again, areas of concern and focus are work-life balance and making sure people understand they can leave the job at work and making sure they get to enjoy the time off that they've not only earned, but they don't have to take their work home from them. And I think coupled with that, focusing on that work-life balance, it sort of coincides with the employee wellness to make sure, like, once you're off of work, make sure you're off of work and unplugged, but there's other resources that you can access 24/7 and that we're here for you and that we're listening and that these aren't just an 8 to 5 resource that you can access, that it's 24/7, 7 days a week. And by doing that, I think we've really sort of expanded the outset of what we've really intended to accomplish of people being happy at work, being able to do their jobs without impediments, as well as making sure that they feel that they're being taken care of, not just at work, but outside of work.
And as you've both outlined, the investment into that, right? We can often think about investment as something, oh, we're building a new building, or here's some new technology, but it's sometimes it is the benefits that we can't see that are not graspable from an investment perspective that are so, so crucial. Scott, same question for you. What's that one thing you want leaders to walk away with, and what should they prioritize as we head throughout the year and then certainly beyond as well?
I think supporting the mental and emotional well-being is incredibly essential. Particularly for successful prevention efforts. So I think that's got to be the main focus. I think in order to do that, you've got to provide employees a diverse group of options, from EAPs to digital tools. We have great partners in Headspace and Spring Health, and enable employees to make sure they're aware of these resources and encourage them to take advantage of them. I mean, there's a lot of data that shows there's very low participation in using high value programs. And I mentioned there's a survey that found that 85% of employees do not take advantage of available mental health benefits. That's a staggering number. And we know how many people need mental health benefits, and the fact that people aren't using those benefits that we've made available for people, it's so critical. So I think helping people understand what is available, helping encourage people to take advantage of them, use them, and make sure we drive toward it. And Michael and Shelley also said the same thing. It's really important that we do that. So I would say it's the key thing, and then it's just ongoing engagement and coaching to make sure that people throughout the health journey. It's not just a one-time thing. It's got to be throughout the health journey to help sustain these preventive behaviors over time. That's what's super critical to drive and improve health long term.
Yeah, absolutely. Well, I hope that we successfully engaged all of you, our audience today. I do want to thank Shelley, Michael, and Scott for being here today, for taking some time out of their day. I want to thank Personify Health for bringing us all together today, for sponsoring today's webinar. And again, thank you for your engagement and for the questions you submitted. We did run out of time for live Q&A, but please know our team will be following up with you after the webinar to make sure those questions are answered. And with that, once again, we hope you have a great rest of your day. Thanks so much for being here. And again, have a great day.
Thank you.
Thanks, everyone.
Thank you.
Goodbye, guys.